Hey guys, so if you've been on my channel for a while, you know topical retinoids is one of my favorite skincare ingredients as a board-certified dermatologist. It's been around a long time. We use it for so many different things aside from acne, skin rejuvenation, as well as medical conditions, and really is hands down one of the ingredients that I swear, kid you not, most dermatologists are putting on their skin on a regular basis. However, there seems to be a lot of misinformation and myths around topical retinoids. So today, in this video, we're gonna do just that. We're gonna bust some of the most common myths that are circulating on the internet on topical retinoids. Hi, my name is Dr. Jenny Liu. I'm a board-certified dermatologist, and welcome back to my YouTube channel. If you enjoy learning more about skincare ingredients, skincare science, and just dermatology in general, you've come to the right place. I would love it if you can give this video a thumbs up. Don't forget to hit that notification button and subscribe to my channel. All right, before we start busting those myths, let's talk about retinoids. What are they? What do they do for your skin? And why, as dermatologists, we love them? Retinoids is a big category of basically ingredients that belong to vitamin A derivatives. And these ingredients commonly known as is like prescription-wise, tretinoin, adapalene, tazarotene. There's other newer generations on the market, as well as over-the-counter ones are really popular, like for example, retinol, retinaldehyde or retinal, as well as like retinoic esters and other derivatives of vitamin A. But the true active form that really works at the molecular level to have impact on your body, on your skin, is called retinoic acid. And this is what tretinoin is, which is why tretinoin is really the OG retinoid that dermatologists prescribe, as well as what we use on our skin ourselves. Now, what retinoic acid does is it actually goes in and binds to receptors on your skin, on your cells, and activates gene expression. That gene expression will have a lot of different impact on the cell, whether that is creating mRNA, creating proteins, improving proteins, increasing certain enzymes that may be involved in impairing skin turnover, boosting collagen, affecting certain inflammatory markers, etc. But that is what retinoic acid or retinoids really do at the end of the day, is they affect gene expression at the cellular level on the skin and thereby having an effect on the skin. So basically, in summary, topical retinoids, what they do on your skin is, number one, they improve skin turnover, they boost and help to support collagen production, and that definitely has been shown to really help with that. They also help to modulate certain inflammatory markers, and this is really important and why topical retinoids help with acne by reducing inflammation as well as boosting skin turnover, helping to unclog pores, and therefore, one of the reasons why topical retinoids are prescribed or recommended repeatedly by dermatologists is because it does help to improve the appearance of fine lines, wrinkles, uneven skin texture, and skin tone. So some of the common conditions topical retinoids are used for are, for example, acne, by helping to unclog pores, reducing inflammation, and also over time, helping with the skin turnover and inhibiting tyrosinase enzyme, which is something I did mention earlier. It also improves post-acne marks, which is why retinoids are really one of the OG ingredients for helping to improve the appearance of blackheads, whiteheads, acne, and post-acne marks. Also, by boosting collagen, improving dullness, and improving skin turnover, it helps with skin rejuvenation, those with skin aging concerns. And by inhibiting tyrosinase, it also helps with melasma and also different types of hyperpigmentation. Now, off-label, we use it a lot for other things, including medical conditions, like, for example, individuals with keratosis pilaris or chicken skin, because it helps to unclog the hair follicles, improving turnover. It will help with those bumpiness. Also helps with normalizing skin turnover in conditions where the skin is super thickened, like, for example, acanthosis nigricans, so also known as like dark underarms, dark neck due to insulin resistance, or in individuals that have basically genetically abnormal skin, which is called ichthyosis, a form of dry skin where their skin can really build up and get cracked or painful. Topical retinoids is used for that. Tazarotene, a prescription topical retinoid, is even used to help with psoriasis. So there's so many different uses of topical retinoids, and you may even hear these days on social media, particularly TikTok, it may help to improve the efficacy of topical minoxidil. I mean, there's so many things, the list goes on. And if you literally look at the literature and publications, probably tretinoin is by far the most studied skincare ingredient that is available by prescription or over the counter, and nothing really beats the tretinoin or the retinoid category when it comes to just being studied and demonstrating its efficacy, which is why probably one of the reasons why dermatologists, we love prescribing it and we use it ourselves for whether it's for anti-aging, acne, or melasma. Okay, one more thing, everything I just mentioned really applies to mostly prescription topical retinoids because they are the strongest, they work the best. The downside to it is it irritates your skin, and that is one of the main reasons why many people have a hard time tolerating topical retinoids. Now, similar concept does apply to over-the-counter retinol and retinaldehyde, and the difference between these two compared to the active form, tretinoin or tazarotene, is the fact that they have to be converted by enzyme in your skin, sometimes one-step conversion, sometimes two-step conversion, just depending on the ingredient, to the active form. With that conversion, you do lose some of the efficacy, but the benefit is that it is far less irritating, which is why we have over-the-counter non-prescription retinoids, so retinol, retinaldehyde, that are really more geared towards skin rejuvenation. That is where the studies have been shown to be the most effective. They're not going to be very effective at treating acne, probably can help a little bit with post-acne marks and hyperpigmentation, but as far as like unclogging pores and improving blackheads and whiteheads, you are really looking at a retinoic acid. So any sort of prescription retinoid, more so than retinol, in improving those things. But overall, the whole family category of topical retinoids, they do have similar benefits. It just comes down to the efficacy, the strength, the power of that ingredient, but also needing to balance it with the irritation, which is by far the most common side effect of topical retinoids. Okay, now after reviewing topical retinoids, let's get into the myths. One of the most common ones I hear is that topical retinoids age you faster. I have no idea where half of these myths or claims even came from, to be honest, and I wonder if it's because of the misunderstanding or a personal experience of the side effects of topical retinoids. But I think a lot of people think maybe one of the things is that topical retinoids, because it improves your skin turnover, improves the skin turnover, which, by the way, your skin cells slows down with age, which is why there's more what we call retention of just the dead skin on the top layer, the stratum corneum, and that buildup makes your skin less reflective of light, leading to dullness that we talk about that is associated with aging skin. And thereby, by adding a topical retinoid, when you normalize that turnover that is slowed with age, you actually look more dewy, more radiant. But somehow maybe that translated to the misunderstanding that by increasing your cell turnover, your cells have a limited capacity and somehow you speed that turnover, meaning you age your skin faster. That is not the case. Your skin, as long as you're alive, is producing cells and turning over. It's just that it slows down with the turnover, just like many things happen, like many metabolic processes happen with our body that slows down with age. Your skin turnover slows down as well, but your skin doesn't have, like, it's not like your skin has an X finite of lifetime. Like if you use that up, you're done. Like for women, we are born with a certain amount of eggs in our body. And once our eggs are done, we don't have any more eggs. We can't get pregnant and we're done with ovulation. But your skin is very different. Like your skin will continue to make new skin cells as long as you are breathing. It's just that the amount and the quality and the rate of it slows down. So topical retinoids, by normalizing your skin turnover, that is slowed down with age, it just makes your skin look more healthy and functioning better. But it does not make your skin age faster by speeding that turnover. So that is completely a myth. Topical retinoids, if anything, improves the appearance of your skin and make your skin look more rejuvenated, if not younger, with long-term use. Myth number 2 is that you need to stop a topical retinoid in the summertime or when you're going on sunny vacation. This is also false, although I can understand a little bit better where this misunderstanding comes from. It really comes from the fact that topical retinoids, like I said, the most common side effect is dryness and irritation, redness, flaking, peeling skin. And this happens really for most individuals in the beginning when they're new and first introducing a topical retinoid, in particular the prescription ones because they're stronger. Your skin will go through what's called a retinization period. I mean, I have so many videos on topical retinoids. Certainly I'll link them below if you want to understand a little bit more about that process. But essentially what's happening here is that as your skin adjusts to the sped up turnover and all the things that the retinoids are doing for your skin, for the good long term, you are going to temporarily have a little bit of a barrier defect, increase in transepidermal water loss, and thereby dryness, flaking, irritation. Now, when that's happening, and by the way, that can happen at any point in time. Like I still, even though I've used a topical retinoid for 20 years, the only times I've stopped is really when I get irritated or when I'm pregnant. I will still occasionally get irritated depending on what else I'm using in my skin. You know, depending on the time of the month, the time of the year. Winters, it tends to be more dry, but usually happens in the beginning. But that irritation, number one, when you're out in the sun, UV light will exacerbate any inflammatory skin condition. So if your skin is red and flaky and dry, when you go out in the sun unprotected, it will just make you more red and irritated. 2, because topical retinoids temporarily cause a defect in your skin barrier naturally has some inherent UV protection. It's not doing that job well. And so topical retinoids really doesn't cause your skin to burn more readily. There are certain oral medications like oral doxycycline we prescribe for acne that will photosensitize you, meaning it will make you burn more readily in the sun. Or say alpha hydroxy acids can do too as well, because the mechanism of glycolic or any alpha hydroxy acid is that it intentionally thins out that stratum corneum. That is how it works. But retinoids don't do that. It doesn't thin out your stratum corneum. If anything, it makes your skin turn over normal and makes your skin overall thicker. So it doesn't really thin out your skin and thereby make your skin more sensitive to sunburns. It's just that if you have irritation, anything will flare with the sun. Now, the reason why I say you don't have to stop your topical retinoids in the summertime or when you're going on vacation is you should always be wearing sunscreen anyway, right? Especially if you're on a topical retinoid. Why I say that? Well, number one, if you're on a topical retinoid, chances are you're treating fine lines, wrinkles, skin aging, melasma, or acne. All of those things we know are exacerbated by sun exposure. So if you're using topical retinoids and not wearing sunscreen, you're doing your skin a disservice. So the first thing you should be doing is wearing sunscreen anyway. So if you're wearing sunscreen, then you don't have to be worrying about stopping your topical retinoids when it's sunny out or when you're going on sunny vacation. The only time you really absolutely should consider stopping a topical retinoid is number one, you're getting super irritated, your skin is red, flaky, and peeling, and 2, is during pregnancy. So yes, you definitely do not need to stop your topical retinoids in the summertime or when you're going on some sunny vacation. You should use it consistently, and really long-term consistent use is going to be key and give you the skin the most benefit. Myth number 3 is that topical retinoids work instantly. I mean, definitely false. And honestly, I cannot think of really any skincare ingredient or product that works instantly, right? I mean, the only thing I can think of instant gratification is like canalolic injections for acne that maybe improves within 24 hours. Physical scrubs, because you're literally scrubbing the top layer of your skin off. But active ingredients, whether it's retinoids, peptides, vitamin C, all of these things will take time because just the nature of our skin, the way our skin works. If you look at healthy skin turnover in somebody who's young, it's about 28 to 30 days, right? And certainly that slows down with time. So that basically means that the base layer of your skin to make it to the top takes that long for it to turn over. And certainly when we talk about acne and unclogging pores, we're talking about orders of that magnitude happening repeatedly to help move the dead skin out, right? Acne, the formation of acne doesn't happen overnight. It takes at least a few weeks. So to say that topical retinoids, you should expect instant results is completely false. And then furthermore, if you think about what topical retinoids are really doing for skin rejuvenation, it's trying to promote and build collagen at that cellular level, and then having visible results takes time because collagen production takes time. Retinoids affect DNA expression and thereby proteins, the enzyme that support collagen. And then you have to make enough collagen to have a true visible result. So we're talking about orders of weeks to months, really. If you look at all the studies on topical retinoids and its efficacy, whether it's acne, melasma, or anti-aging, you're really looking at least 6 weeks, but probably longer, like 3 to 6 months, especially when we're talking about improving hyperpigmentation like melasma and fine lines and wrinkles, just because it will take that much time to have a visible result that is seen with our naked eyes. Cellularly, if you were to biopsy your skin or look at your skin, you probably can appreciate an improvement in like maybe the melanin index or say the amount of collagen when we take a biopsy of the skin. But just because the collagen increases, it doesn't always translate to what we see visibly. So when we're talking about visible results, I would say give it at least 3 months to 6 months. And so this is why you want to stick with your topical retinoids for that long before you switch to a different one or before you even give up on it. And that is true, I would say, for most skincare products, but especially ones that really affect your skin at that cellular level and you're looking for visible results. It's going to take time, especially when it comes to improving texture and skin tone. Myth number 4 is you can't use topical retinoids with vitamin C. I think here is more just, again, going back to the misunderstanding. Number 1, really the biggest thing that is just the misunderstanding is topical retinoids itself is inherently irritating. And vitamin C, depending on the formula, most commonly L-ascorbic acid, it's an acid, it is irritating. So if you have that type of skin where you can certainly tolerate it, by all means, your skin is not getting red, flaky, inflamed, go for it. The two does not cancel each other out. In fact, you probably can find a lot of different products on the market that are co-formulated with a topical retinoid and some sort of vitamin C, because together they do give better skin benefits in terms of just brightening the skin, improving dullness, radiance, and also boosting collagen. Vitamin C itself is a cofactor on the enzyme that our skin uses to make collagen. So vitamin C certainly supports collagen production. And of course, retinoids, we already talked about it. It really is one of the well-studied ones that boost collagen. So certainly the two, if you can find a product formulated with the two together, it definitely has been tested to show less irritation. And if you want to use one together, by all means, go for it. But really, it's not that you can't because they interact. It's really you want to keep them apart due to the potential of irritation. And so in my mind, it's not that it's an absolute rule that you can't use them. It's just more like everybody's different. But also, I like to use my vitamin C in the morning because that's really where you get the most bang for your buck with your vitamin C serum. It's an antioxidant. It helps to defend against pollution, environmental aggressors and UV damage, along with brightening. And then your topical retinoids, most of them you should be using at night because they're sun sensitive or UV light sensitive. So it really, in my mind, makes it simple. I kind of split them up. So that way, number 1, you're getting the benefits of both when you need both. And 2, it really reduces the likelihood of irritation. So again, it's not really a myth. It's just mostly a misunderstanding, or I should say the fear of irritation that really should be driving the reason why you shouldn't use them together. And a product that has two formulated together is going to be less irritating. But like I said, I like my vitamin C in the morning, my topical retinoids at night, and that makes it simple for me. So that way I don't have to worry about getting irritated and get benefits from both products. Last myth, just going to clarify, say it out there. Retinoids thin the skin. It is completely false. Again, going back to the science. So let's talk about why retinoids doesn't thin your skin and how they're different. Again, I think the biggest misunderstanding is the fact that a lot of people think they work like alpha hydroxy acids. So maybe starting off with AHAs, alpha hydroxy acids, what they do and why they're helpful for like keratosis pilaris or flaky dry skin is that it literally helps to reduce that buildup of dead skin, aka the stratum corneum that is literally at the top of your skin. So that's what alpha hydroxy acids do. Now, certainly they have other benefits as well, depending on the type of acid, but essentially alpha hydroxy acids help to thin out that top layer of the stratum corneum, and that's how it works as a chemical exfoliant. Now, topical retinoids, as I mentioned earlier, it helps to speed up skin turnover. So what that means is it's helping to speed up the rate where the skin at the base layer of your epidermis, the basal layer, and how fast it moves through the different layers, reaching the stratum corneum. Now, remember I said that normal healthy skin, somebody who's young, that turnover is about 28 days. As we get older, that turnover slows down, which means there's more what we call loose, less compact stratum corneum that is on top, because just the metabolism of our skin is reduced with age. That loose stratum corneum is not as what we call compact, is not as put together, and so it doesn't reflect light as readily, giving the appearance of dullness. And also that retention of dead skin also makes your skin more dry, potentially maybe look more dark, and certainly affects the pigmentation part. So topical retinoids, like I said, what it does is it speeds up that turnover, but at the same time, in the dermal layer of your skin, boosts collagen. So by speeding up the turnover, what you actually see if you were to sample the skin of someone who's been using a topical retinoids for a long time versus someone who hasn't, and an aging skin, is that overall, the thickness of your skin is actually better, like it's thicker. But what you see when you compare the stratum corneum is that in someone who has sun-damaged skin, the stratum corneum is looser, it's not as compact, thereby giving an more sun-damaged skin. But in a retinoid skin, that stratum corneum is more compact, thereby the skin looks more radiant and less dull. So no, retinoids do not thin your skin. And in fact, if anything, and we've proven with so many studies and skin biopsies, that is overall that your skin is thickened and not thin. It just makes the top layer of the skin more compact, not as loose. So again, I think it's just kind of boils down to the fact that there is just a lot of misunderstanding about the mechanism of how topical retinoids work. But yeah, if anything, if you're looking for an ingredient to actually bulk up your skin, improve the skin thickness, topical retinoids is by far one of the most studied and evidence-based ingredient to do so. So again, topical retinoids do not thin your skin. If anything, they thicken your skin, reduce the appearance of fine lines, wrinkles, and support collagen production. All right, guys, so that is it for today's video. A little bit more science, a little bit more nerdy, but I hope you guys enjoyed it. And if you certainly enjoy this type of myth-busting video, please let me know in the comments below what you want me to talk about next, what other topics or what other myths you've been seeing, or just topics you're confused about and you need some clarification. Now, I did not mention any products, but I'll make sure to link below videos in the past that I've recommended products on, as well as videos on like how to tolerate a topical retinoid if you have been struggling. But I also will add a few products below from drugstores without prescription, including adapalene, which is without a prescription, whether it's for acne, anti-aging, or hyperpigmentation. So certainly check out the description box below. As always, drop your questions below. Thank you so much for watching. I will see you next time.